I'm often talking about the importance of finasteride for preventing further hair loss and how that plays into hair transplant surgery in terms of being able to build on a solid foundation that the finasteride can create. But when should we consider stopping finasteride? That's an interesting question and something that we don't talk about enough. So here we are discussing when we should consider stopping finasteride. A few of these reasons might seem rather obvious to you, but I think a few of them will actually surprise you. One reason is if you're continuing to lose hair. Remember that finasteride has the ability of controlling hair loss in about 90 to 95% of men. That means that it brings hair loss to a halt in 90 to 95% of men. But if you fall into the 5 to 10% of men that don't experience a cessation of hair loss, then you might consider stopping finasteride because it's not doing enough and potentially bumping up to the more potent version, which is dutasteride. Dutasteride, at its most common dose of 0.5 milligrams a day, is protective in about 98% of men, compared to the 90 to 95% of finasteride. But sometimes you need to increase the dose further, and I've gone as high as 2.5 milligrams per day of dutasteride to be able to control someone's hair loss. But as you make the switch from finasteride to dutasteride, and as you start to increase the dose of dutasteride, what happens is you increase your side effect potential as well. So increased efficacy also comes with increased potential of side effects. So for example, when it comes to sexual side effects, with finasteride the incidence might be 2 to 3%, but with dutasteride it climbs to as high as about 4 to 6%. So that's almost double the incidence of sexual side effects with dutasteride, and that's one reason why we don't start with dutasteride for most men when they're first experiencing hair loss. So you're essentially stopping the use of finasteride because it's not doing enough. That's surely one good reason to stop its use. Another reason to potentially stop the use of finasteride is if you're experiencing an allergic reaction. This is very different from a side effect. A severe allergic reaction might come with life-threatening consequences, and they can happen very quickly. And this is something that can be experienced with any type of medication, but it can also happen with finasteride. So we have to be aware of some of these signs and symptoms of an allergic reaction, and that includes rash, hives, difficulty breathing, facial, mouth, or throat swelling. Luckily, these are overall very rare with finasteride, but remember that people can be allergic to anything other than maybe water, so it's very important to be on the lookout for some of these signs and symptoms that can be quite troubling and that can come on very quickly, and one of these reactions might actually land you in the emergency room because of how severe it can be. So never discount the potential of one of these allergic reactions when taking any new medication. And if a reaction like this develops, then I would completely stop the use of finasteride and never take it again. And make sure to tell future doctors and clinics that this is one of your allergies so that they consistently list it on your list of allergies. Another potential reason to stop the use of finasteride is if you're experiencing one of its known side effects. That can include one of the sexual side effects that many men fear, or one of the other side effects that finasteride has been associated with. And there's a short list that we're providing here for reference. Side effects from finasteride usually present in the first few weeks from when the person starts taking the medication. The general recommendation is if you develop one of these side effects, you should stop the use of finasteride until at least that side effect clears up and you're back to normal. You would then potentially restart the use of finasteride at a lower dose. Side effects tend to be dose dependent, so as you come down on the dose of finasteride, usually you have fewer side effects. Now, this type of de-escalation of the dose of finasteride should be done under supervision by your doctor doctor and not just something that you're doing at home on your own without any input from a medical professional. Now, of course, some people who develop side effects from finasteride might choose to permanently stop the use of finasteride. That's understandable, but keep in mind that there is no true substitute for preventing the further loss of hair compared to the efficacy that finasteride can provide. And what I found in my practice is that when I bring people down to a topical formulation of finasteride at, say, 0.3%, it's very rare to have a side effect. Is it possible? Sure. Is it extremely unlikely? Yes, it is. And the incidence is not as well documented in the literature because it's a newer type of administration of finasteride. But in my practice, I would place it at maybe under 1%, probably closer to about 0.2 to 0.5% of people who are on 0.3% finasteride topical who might still have a side effect. So that is of course a consideration, but because the efficacy of topical finasteride is surely significantly lower than oral finasteride, we don't recommend that people start with the topical form. Another reason to potentially stop the use of finasteride is for pregnancy planning. Finasteride can affect semen in several key ways: lowering the volume, lowering the sperm count, and reducing sperm motility. Now keep in mind that there's no substantial evidence to support the claim that finasteride will permanently cause infertility. Instead, semen quantity and quality will restore back to normal in about 3 to 6 months with the stoppage of finasteride, according to several studies. So in my practice, I usually recommend that male patients stop the use of finasteride for at least 3 months before trying to conceive. Once a healthy pregnancy is confirmed, they can then resume the use of finasteride. And it takes about 6 months to start to see some of the potential continued fallout of hair if you've stopped finasteride. So usually if you've just stopped for 3 months to 6 months because you were looking to confirm a pregnancy, well, then you should be safe from a hair loss perspective. Yet another reason to potentially stop the use of finasteride is because maybe you no longer care about your hair. Because some guys tell me, look, I just want to have hair so I can find a spouse, and then I don't really care what happens with my hair. Or they say, look, I just want hair to get through my 20s, and then if I lose my hair, so be it. So if you're in that boat, if you reach a point where, you know what, it doesn't really matter if I have hair, if I don't have hair, well then you can surely stop finasteride, but be ready for continued hair loss. Remember that finasteride is a generic drug, so it shouldn't be too expensive to obtain. So if I haven't scared you yet from trying finasteride, remember that you can get finasteride shipped to your door at a very affordable price. So if you're interested in that, you can head to feelconfident.com. And if you have any finasteride related questions, make sure to leave them in the comments below. I'll try to get to as many as I possibly can. And if you have a very specific clinical scenario, it's best to reach out for a consultation.